pushing self-care. What are barriers to self-care? And of course, this program is in partnership with the Ministry of Health and Makerere University School of Public Health. With us is a team of the full board. I would call it the full board. But of course, I'll start by introducing the person just is on my immediate left, and that is Fatia Chiange, who is the Executive Director of Center for Health, Human Rights and Development, which we commonly know as CEHAD. It's a pleasure having you this evening.
Thank you, Adrian. Good evening, viewers.
And then, of course, next is Dr. Christine Nalwadda from the School of Public Health, Makerere University. Doctor, it's a pleasure having you this evening as well.
Good evening, viewers.
Okay. And then Dr. Roslyn Achola, who is the technical advisor, of course, from the Ministry of Health, and of course, she's at the center of self-care. Doctor, it's a pleasure having you as well.
Thank you so much, and good evening, viewer.
So the team is here, and we are like I said, we are talking about self-care, and we shall talk about self-care in detail. Today we want to introduce ourselves to self-care, understand self-care, the inner depth interpretation of self-care, so that you can know what exactly it is. And of course, that is what we are going to look at entirely today, and the rest of the minutes we are here. Now, talking about self-care, and we know that the Ministry of Health is pushing self-care, the ministry is fronting self-care. People would really want to understand what self-care is. Dr. Christine, could you please tell us what self-care is in its broader interpretation?
Okay, thank you. Self-care, this is a broad concept, okay, but what it means in simple terms, it is the ability of individuals, families, communities, to take care of themselves in terms of preventing disease, promoting good health, with or without, with the help or without the help of a health worker. So it empowers you yourself to do certain things for yourself, to make sure that you keep yourself healthy. You don't need, there are certain things that you don't need to do with the help of a health worker. For example, if, say, you've been given medication, you can take this medication without the help of a health worker. You don't need to wait for a health worker to take your medication on time and as you were told to do so. So self-care equips us with that ability to be able to take care of ourselves and to make sure that you keep healthy.
Okay, this sounds interesting, and it sounds something so beautiful. And Dr. Roslyn, now I request you to tell us why the government is fronting self-care, yet we see they are also putting a lot of efforts in enhancing health facilities.
Okay, thank you so much. We are happy, first of all, that we are here today to talk about self-care. As my colleague Dr. Christine has defined self-care, Government of Uganda has picked a lot of interest in advancing self-care agenda in Uganda. And it is not just the initiation of Government of Uganda. It is a World Health Organization global initiative that was developed as a result of COVID-19, given the situation that we had the world over. Both health workers, families, everyone was equally affected. And if you all remember, families took responsibilities on responding to all the informations that were given globally to try and cope with the pandemic and as well as managing it. You and me know very well what we did. There was no health worker in our homes, but we knew that we needed to wash our hands. We knew that we needed to take hot water. We knew that we needed to steam in order to kill the viruses and so many other things. Isolating ourselves for those who were infected with COVID and so many other things. So based on that, was found prudent that people need to have the powers to prevent the diseases, as Dr. Christine has said, to promote good health and maintain good health with or without health worker. So Minister of Health, from the global guidance, developed a Uganda context-specific guideline to guide the country on how we, the citizens of Uganda, can actually practice self-care. And in the guideline, we have different components that make up self-care. One of them is HIV/AIDS. In HIV/AIDS as a component, we have what is called HIV self-testing. It is a testing that anybody can do it within the comfort of their houses. And they are taught how to interpret the results. And should the result be positive, then they are also informed of the next step, which is referral for confirmatory test. Now, if I leave HIV and talk about other diseases like hypertension, like diabetes, people have been told how to go home and practice certain things. For those who are living with diabetes, they know very well that before, nobody was allowed to hold a syringe and inject themselves. But because of the emphasis on self-care, and as I said earlier on, that government of Uganda has borrowed this from the global context to help us decongest our facilities, to help us live healthy and be able to cope with the situation we are in. So patients with diabetes are now injecting themselves from home. Women who are on contraception are injecting themselves from home. Instead of going to line up in a facility for hours and hours, why don't we give opportunity for the health workers to be able to handle the most critical, the most complicated cases, instead of lining up and waiting for this one doctor, this one nurse who has a long line of women to offer antenatal services to, or to conduct deliveries. Antenatal care is one of the components, and why antenatal is overemphasized is because of the fact that many women are dying in this country. The statistics now show that 189 per 100,000 lives births, women are dying in this country. And they are dying simply because of some preventable conditions or things that can be prevented. And for a woman who goes through birth preparedness, who has embraced self-care and knows that for me to have a better pregnancy outcome, I must eat balanced diet, I must eat on time, I must take my supplementation that I'm given during antenatal, I must prepare even where I'm going to deliver from, I must know the health worker who's going to deliver me, I must have some money with me that will help me to travel should any emergency start at night. That is self-care. Nobody will do it for you. As an individual, as a family, as a community, that is what people have to do. So the government of Uganda and Minister of Health in particular is emphasizing self-care practices to help the population live healthy, live longer, and also decongest our facilities. So as we continue the discussion, we're going to give you more information on how this is happening, where, and what do we need to do. Exactly. But in a nutshell, that is really why the government of Uganda is embracing self-care to help the population, or to help our country realize universal health coverage.
Thank you so much, Dr. Roslyn. When you were talking about this, we realized that partly you are saying that it helps the government one, to decongest the facilities so that these health workers can now attend to more critical illnesses. But now someone really wants to know, what about me, the patient? What is the importance of self-care if I do not have to move and go to the facility all the time? Fatia, what are some of the benefits that come with self-care?
I think the benefits of self-care are both at individual level, at the family level, community, and also at the broader level for government. Okay. When I think about, say, my grandmother at home, and indeed I have one, who, for example, has diabetes, and I have to help her inject insulin every day. You imagine a situation where somebody has to live their entire life on insulin, and you imagine if you have to take her to hospital every morning. What does that mean? It means you have to have time on you. It also means you have to have some money. It also means you're going to take her and then she sits in a line. She's old. Remember, she's old. So one of the benefits for self-care is the comfort within which one can access care. And remember that universal health coverage, it's important for people to receive health care at the time they need it and in the place of their choice. That's very important. So self-care brings that. But you also know that health is made at home. Many things that impact on our health are things that we do at home. Some of them is the lifestyle, the way we live, our diet, what you eat, whether you do physical activity or not, that is exercise or not. This is all in your home environment. But then, when things go bad with your health, you actually go to hospital for your health to be repaired. What if you thought about making sure that all the things you do at home, all the things you do in the community are things that make you healthy? It means you probably will not need much. You will not need a lot of going to hospital for your health to be repaired. And at the end of the day, that saves money. It saves you as an individual money. It also saves your family money. It also saves the community and the government money. Those are some of the benefits. But also self-care is it's a good one for those communities and those people who are difficult to reach or who have difficulty in getting to our healthcare facilities. Take an example of persons with disabilities. There are those who would really want to access services, healthcare services, but they are unable to go to healthcare facilities. So if they are empowered to be able to do self-care, from where they are at home, then you will actually improve access to healthcare by those people who have difficulties getting to healthcare facilities. You will also save them the money, the transport to move and go to a healthcare facility. So that's also very important. Those communities, those individuals, families that some are even living in remote places or places that are difficult to reach. In our work at SEHAD, we engage communities that live on islands, where, for example, you have to take a boat, you have to travel via water to look for a healthcare facility on land. What if you made sure that all those people on islands, they know about self-care, they know what to do to prevent hypertension, they know what to do to make sure that they know their HIV status, they know what to do themselves to prevent or to even check for sexually transmitted diseases. Of course, you would be gaining so much because they will not come to on the mainland to get services, but they are able to do certain things where they are in the islands to be able to access care. So all that, but also I want to say that in our country, it's true that we do not have all the healthcare workers we need in the system to manage everyone. Even when we have healthcare workers, they have big loads of workloads. So if we think that everybody will go to hospital, just like she said, COVID time, even when many of us wanted to go to hospital, the capacity in the hospitals was not sufficient to cater for everybody. So getting everyone to mind their own health, to be able to do certain things. It is during the COVID time that I learned how to check my oxygen level using the little thing, the oximeter. It's the first time I learned about it. I was told to use it, I used it. Mm-hmm. Interestingly also, it is at home when I got interested, because it was difficult to go to hospital because of the lockdown. So I procured my testing kits, a box of my testing kits, invited a healthcare worker to teach me how to do it. And at home, we were able to do our testing. If anybody wanted to do a test for COVID-19, we would do it at home. So I think for me, self-care has the potential to transform our health as individuals, as families, and as communities. But we need to be given the information. We need to be helped to understand what to do, to be able to do it safely. I think for me, there are so many benefits. And from what I've said, it saves costs. It makes a person access healthcare even if they were otherwise not able to, and in their or in the places of their own comfort. So there are so many benefits. When you look at young people, and I know that family TV, many young people watch family TV. So I want to speak to young people here that when you look at young people, many of them, when they get sick, when they have certain conditions, they fear to go to healthcare facilities. But here is self-care. If they are taught what to do, they will be able to actually take care of their own health. You see that? Also, I want to note that even when self-care is that ability to look after yourself, whether you have a healthcare worker or not, there are certain times when you will actually do self-care, but then you will need to interact with a healthcare worker or with the healthcare system. Take an example: if somebody has tested for HIV and the test is positive, you know, so there is a lot that can take place there. This person needs now to go to a healthcare worker, to a facility, to confirm this result before even problems come up at home. You know, they're supposed to go and confirm, but you see also when you test positive, you need to take certain steps. You need to get onto medication and so on, and you can't do that yourself. So even when you're doing self-care, there are certain times when you actually need to interact with the healthcare system. But it makes it easy, because when you've already done your testing at home, you have your results. When you go to a facility, you will not sit in that long line of those ones who have not tested at all. Healthcare facilities are now providing spaces for where, if you've already done certain steps at home, it becomes easy for you because you've already done certain things from home.
Okay. Thank you so much, Fatia. Doctor, you wanted to supplement?
Yes.
Please do.
Yeah, based on what Fatia has said, actually, there are three things that Minister of Health is fronting in self-care. One of them is self-awareness. People need to know what are the things that they need to do, how should they do it, when, and then afterwards what happens. Then two is self-testing, like she has mentioned. In self-testing, people need to know what it is before they even think of managing. Like she has talked about testing. Simply now we have, even for malaria, there is simple tests that you do it at your own leisure. I already mentioned for HIV. So self-awareness is very important. Self-testing is very important. And self-management, which Dr. Christine mentioned, that when you are given medication, how do you adhere to it? So those three things are very important. But there are 5 pillars that is required for self-care to take place. One of them is the health literacy. People need to know, because when people don't even know how HIV is prevented, then they will not act. So health literacy of the people is very important, how to prevent, how to test, and how to manage it. Then two, the health professionals. All this is done with the help of a health worker. Nobody will wake up and know how to do self-testing or self-injection, but there must be a health worker who will take you through on how to practice the self-care we are talking about. Then the third one is the healthcare system. We have the Ministry of Health, well-structured health system that has the health workers with all that it takes to show you what you're supposed to do in order to practice self-care. And then the fourth one is the medication, the medicines. What are those medicines that can be used? She already talked about insulin. I talked about contraception for self-injection and many others. And then the fifth final one is actually the technology. The technology has been made so simple that any woman, any young girl, any gentleman can actually use them to inject themselves, to test themselves, or to do whatever testing they want. So it is very, very important for us to know that Ministry of Health has those 5 pillars. And that's why we appreciate the government of Uganda that we have a functional health system, we have the health workers, we have the technology. And we also thank our partners who come in to support government, like SEHAD. They do a lot with us. We have the UN family. We have other governments who come in to support the Minister of Health in introducing these technologies. So it is now our role to know that these technologies exist. It is our role to pick interest and appreciate what we need to practice in promoting self-care for us to live healthy and live longer as well.
Okay, thank you so much, Dr. Roslyn. We are going, before Dr. Christine can add on this, we are going to take a short commercial break. When we return, we shall start with Dr. Christine, re-emphasizing the importance of self-care. Stick with us as we come back. welcome back from that commercial break. Here we are with the family hour. In case you're just joining us for the first time, of course, this is the second part of today's edition of Family Hour, and we are looking at self-care. Of course, we are getting into the details. We want to understand what self-care is, and of course, with us is a team. Dr. Christina from Makerere University School of Public Health, Dr. Rosalind from the Ministry of Health, and Fatia from SEHAD. Now, before the break, Dr. Christina, I wanted to call you, I wanted to request you to talk about something, because while they were talking about the importance of self-care, the importance is exciting, and we are Ugandans. And because we are Ugandans, someone will say, aha, so someone can relax. So, are there any myths and misconceptions associated with self-care that you can address?
Okay, thank you. And building on what my colleagues have been talking about self-care, they've given us the benefits, all the good things. But what I want to point out is self-care should not be taken to mean self-medication. So when we say self-care, we are saying, yes, take care of yourself, do those things that make you healthy, but we don't mean that you go ahead to self-medicate, meaning, for example, if you feel unwell or you are sick, you just go to the, say, to the pharmacies or drug shops and then prescribe yourself any medication, or just say, I want to buy this because I'm sick. That is not self-care. So it is not self-medication. So you should, on the side of the self-care, what we mean is, for example, adhere to your medication. Take your medication as it has been prescribed. But we don't mean that you should self-medicate. I think those two things our viewers should take them, should make out that difference. That self-care does not mean self-medication, where you go and buy medicines just because you think you have, say now, you know, now, for example, diabetes is very common now. You don't just go out and say, I want medicine for diabetes because I was told that when someone has diabetes, these are the symptoms, and I have these symptoms, so I think I have diabetes, so give me these medicines. No, it's not self-medication. When you are unwell, please go to the facilities, go and see a health worker, but after engaging with a health worker, then make sure that you adhere to your medication. But the other aspect I also wanted to point out is that these benefits, the benefits of self-care, it gives us an opportunity to even participate more as families, because as individuals, as families, as we live in our communities, it gives chance to everybody to do what? To participate, to ensure that we are all healthy. For example, let me give an example of immunization. When we immunize our children in our homes, you immunize your child in your home, but your neighbor should also immunize, and the other one, so that at the end of the day, all of us are immunized, because that's when we shall realize the benefits of, say, the immunization. So self-care goes that far to ensure that the individuals, the families, and we work together as communities to ensure that we are all healthy as a community, so that we realize those benefits, the saving of time and then saving of monies and other things that come with those savings.
Yeah. Thank you so much, Doctor. Just remind you, you can be part of this program by strictly sending either text message or WhatsApp on our studio line. But in case you do not have the line, I can read it out for you. It is 0787 447684. 0787 447684. Do not call, just send a text message or a WhatsApp message. You have a question, you have a compliment, please send in your comment in time so that it can be responded to. Now, talking about this, Dr. Rosalind, we see that from what Dr. Christina said, and from what you said earlier, you say that the government is fronting this, but are there already things done that are in place as a way of enhancing self-care? And when did the government actually pick up this self-care initiative?
Thank you so much. As Uganda, we contextualize the global guideline in the first one in 2022, which was limited to only reproductive health. But because of the demand, then we reviewed and developed a national self-care guideline that is for health and well-being. And that guideline was launched last year during the Safe Motherhood Conference by the Minister of Health, Honorable Dr. Jane Ruth Asheng. So that is the first milestone for us as a country to have a guideline. Then 2, we've also gone ahead to develop an investment case. The investment case is helping us as a country to appreciate the worthwhile investment, the returns to investment, that if government of Uganda invests in self-care, invests in supporting the practices of the citizens to practice self-care, how much will it save in treating the complications? It's like looking at a young girl who is in probably S1, who has done an abortion, and the abortion was unsafe and she gets complications. Treating that girl until she recovers costs government a lot of money. And yet if we go out there and tell the girls that don't get pregnant, stay at school, practice self-care, value yourself, cherish what is around you, think big, look at your future, what you want, that one is the best thing government can do to save money. So investment case has modeled what can be invested on to be able to save money. 2, we've also reached out to our members of parliament. You know, budgets are located in this country based on the beliefs and the need. And the members of parliament always challenge us that if you don't tell us what is the right thing to be done and why, then we will not support the budget. So bringing members of parliament in an orientation meeting, having them as our advocates in parliament and in government is very important. And we've reached out to over 100 members of parliament to be able to appreciate what self-care can do in their constituencies, having healthy people who can vote them. We have also reached out to the media, and I'm happy we are now on the media, but we've had orientation meetings for different media houses. And the reason why we do this is for positive reporting. What are the positive components that they can pick on and air it to the public to be able to understand? Because I am speaking here, but if I was speaking within the boardroom of the Minister of Health, people would not know. So the media play a big role in reaching out to the community with the right messages. And as Minister of Health, with support from partners, SEHAD has done this a lot, and other partners out there, in helping them to appreciate what self-care is and how their role is very important to roll out self-care in the country. But we have also reached out to the other ministries. You all remember that it is a big concern in this country, and the president has actually gotten this as a big item on his agenda, that why do we have non-communicable diseases in the country? People collapse in their cars while they are driving, people sleep and don't wake up because of the lifestyle that we are leading, lack of exercises. And the president requested that public service rights to the Minister of Health asking Ministry of Health to write to all ministries and all institutions to have at least a day or two in a week of physical activity. That alone helps the people to remain healthy, to prevent the likelihood of hypertension, of diabetes, and other diseases. And that all tells you that really as a country, the way how we have popularized self-care, the way how we have reached out to the media, people now have appreciated that at least a jogging in the morning or just jumping around your compound is very healthy. It helps you to have good heartbeat, it helps blood circulation, and can help you to live longer. In the Ministry of Health, I'm happy to say that every Friday, it is a physical activity day. Right from the minister up to the lowest cadre, they are all out to exercise. We also have other partners. One time I was passing by the police, and they have one day where all those bosses get out in their track suits to do physical exercise, aerobics. And the military, we are working with the military to make sure, in addition to their exercises that they do, they also take health as something very important. And to me, this is very key, that we must support our people. I talked about literacy. People may not know that by leading sedentary life, it is putting their life in danger. You wake up in the morning, eat all that you want, sit in the car, which is air conditioned, get to office, air conditioned, there's juice, there is yogurt, there is everything, and then sit the whole day, and in the evening you are in air conditioned Land Cruiser and driving back home. You reach home, you are seated behind a TV, and then food is brought in plenty, and then they go to sleep. So when somebody does not wake up, whom do you believe? Do you blame? Others will say he was bewitched in office. Others will say, he's quarrelsome. Oh, he quarreled with a neighbor and the neighbor has killed him. No, it's just we who have given our life the difficulty. Life is trying to push, but we are pulling it down. We are saying, no, I want to go. So I'm telling everyone listening, if you are the type who's not doing physical exercise, if you are the type who's not eating on time and just enough, don't again fill up a whole plate. I always tell people, for dinner, why do you eat a whole plate of kalo, matoke, and yet it is time for sleep? You are punishing your body. Actually, in the subsequent talk shows, we are going to have somebody who's going to talk about nutrition. When do you eat your last meal in a day? For you to sleep safely, to sleep well, and wake up happy. So physical activity is very important, and we are really trying to make sure all ministries allocate a day. I'm happy that the RDC of Dokolo has been a very great champion. She made sure in her district, every Thursday, everybody gets out right from the DPC, and they walk, they do aerobics, they jump around. And one day she came and testified that, you see, I'm now light. And that's what we want. Can people come up? It is something very simple. The Ministry of Health is organizing Physical Activity Day on 22nd. I'm using this to advertise for, for the organizers. I'm part of the organizers. And we are calling upon everyone to come to Kololo. His Excellency is the one going to lead. To come and join the Physical Fitness Day. And after that day, can you do it within your home? I always tell people that when I go back, the moment I arrive, when I want to take my shower, I enter my bathroom and first dance. I put pepe kale, paka chini, and feel good and laugh and enjoy and sweat. Then I take my shower. So those are small things that we need to do to remain healthy and remain physically fit. So there is a lot that we are doing and we want to continue doing.
Okay. Thank you so much, Dr. Rosalyn Fatia. Talking about this that the ministry is doing, but your partners who come in to support the implementation of self-care. What are some of the challenges and barriers that come with self-care that you have associated, with, especially in the society?
Okay, so I think number one is that there is still limited understanding for self-care. And I think for me, TV talk shows like this one is important to get the public to understand. And I think we are speaking English, but we also need to ensure that we can help communities to understand self-care in different languages, those that speak different languages. So that's so far a challenge that we are yet to make sure that everybody understands what we mean when we talk about self-care and how it is achieved. That is number one. Number two, self-care, we kept talking about self-care products. It's products including testing kits, including everything that goes with it. We are yet to see, and we know that in our country we do have stockouts. It's something that we know. We have stockouts for medical products, but specifically, I think so far what we are observing is that there are also some stockouts for self-care products. I know that Ministry of Health is trying to address this with national medical stores and other partners, but this is real. You imagine when everybody is aware and understands self-care and they want to use it. So then they go to maybe get testing kits and they don't get the testing kits. So I think that's an area of challenge that has to be prioritized, that when we promote self-care, then we need to make sure that all the products and commodities for self-care are available and people can access them. Then the other one, I think there is also fear for some of the self-care approaches. Traditionally, even maybe some of us that are here fear, for example, to inject ourselves. Yeah, so that could also be a barrier, that because somebody fears to inject themselves, that can be a barrier to them realizing or even taking care of themselves. So that means that this person, for example, with diabetes will have to go to a hospital every day for the injection, yet actually they can do it. Why? Because they fear to do it. So those are some of the barriers. The other ones, I think, are to do with healthcare workers. The traditional medical model is in such a way that everything about healthcare used to be done by healthcare workers. Here we are talking about the fact that individuals and families can actually do certain things. Some of these used to be done by healthcare workers. So sometimes as we promote self-care, you find some resistance coming from healthcare workers because they know this is our work and it's being taken away. But I want to reassure healthcare workers that, as we have already said, self-care is integral to the healthcare system, and that healthcare workers have a supportive role to individuals and families and communities. So it's not taking away the work, but instead it's actually relieving healthcare workers of the workload for them to concentrate on the critical areas that need their attention. The other one, I think, is the other challenge or barrier that is yet to be addressed is if everybody, for example, goes in for self-care and uses some of the commodities, some of them need like maybe disposal, like the syringes and so on. How do they dispose of the products? And I think that's something that ministry is exploring to make sure that when, for example, somebody is injecting at home, they know how to dispose of the injection or the syringe or whatever. So that's an important area that the ministry has to venture and ensure that proper mechanisms of disposing self-care wastes are done by individuals and communities and families. Okay. I think that's so far some of the challenges that are coming through. I think the other one is, it's important to measure progress, to have data, information. For instance, if you wanted to know how many Ugandans are doing self-care, you should be able to know so that you plan accordingly. You plan for the products, you plan for awareness creation and so on. So I think that's an area that we need to think more about. How do we, if I'm in my house and I do HIV testing or I do self-injection as a contraceptive, how will ministry get that data, that information, and put it in the information system for the country? I think not necessarily a challenge, but it's an area that we need to think about to make sure that we get the data to ensure that the data informs planning, informs services, and informs policies. I think that's another important one. And I think finally the other barrier or challenge is, I think I talked about information, and information in the language that people understand, and I'm sure the media houses like you will be helping, and the ministry has done, with partners, has done messaging for self-care, and I hope that that messaging will now start coming through for the communities to understand self-care properly. I think those are some of the things that we are seeing as challenges, but we are also reassured that a lot is going on to address some of these barriers and challenges.
Okay. Thank you so much, Fatih. I'll go through a few comments here that have come through, and then we shall see how we wind up. One, I'm Emma, watching from Chevando. My biggest concern with self-care, yes, I've had medics talk about self-care, but I still think that we need more information and more sensitization so that we do it the right way. Thank you so much, Emma. Thank you so much for the show. Esther, watching you live from Namirembe. Okay. Thank you so much, you who is watching us from Namirembe Guest House. Thank you so much. Okay. People are appreciating. This is a concern, and I think it's directed to you, Dr. Jocelyn. It is so surprising that we are hearing about most of these things today. Had I not watched this TV, I wouldn't have known that the ministry is actually doing a lot of these campaigns about self-care. So, don't you think that you need to invest more, especially in publicity, than having corridor talks in the ministry? Okay. So that is a concern. Thank you so much. Yeah, I think most of the people are appreciating the message, but I think we can, especially the two concerns where someone says you need more awareness, but also someone saying that they're afraid people might still confuse self-care with what Dr. Christine talked about as self-medication. So, Dr. Rosalind, why do you keep this very beautiful message in the corridors of the ministry?
Okay, thank you so much, and I'm so grateful that what is his name? That he has brought that very important question to us.
Sanyu Nabagala from Matuga.
Sanyu, thank you so much. Indeed, like we said, we are here on Family TV, trying to talk to those who can listen. Always there are programs. We've done district awareness, the first one to commemorate self-care as a national event in line with the international commemoration. The first one, we were in Dokolo district. That was in 2023. In 2024, we joined Kayunga district to commemorate self-care awareness month. And this month is usually from 24th June to 24th July. So the whole of that period is for popularizing self-care. It's unfortunate that maybe when we are in UBC, finds when somebody is not tuning. And it is the very reason why we are using various media houses. We are here today in Family TV. We've drawn a program with Family TV, and we are going to be having series of talk shows addressing different components of self-care. But also in other media houses, they are talking about this. When we oriented the journalists, we asked them to be in position to continue passing the information to the community. And I'm happy to note that some journalists have actually published messages, information on self-care. So it is true that some people may not be aware, but we appreciate that concern. We are going to intensify how best we can make sure the entire country is aware about self-care. We will use all approaches, community dialogues, because not everyone can afford to be on a TV, using radios. We have the village health teams, and also our own health workers should be able to tell the people when they go to the facility. But I really appreciate that concern.
Thank you so much.
It's no longer a corridor talk.
Exactly, it is no longer. Dr. Christine.
Yes, thank you. I just wanted to add that yes, that's the very, very reason why we are here, to try and sensitize our people, make them know about this important concept of self-care. But in our previous activities that we have been doing, we have engaged the religious leaders of all denominations, so that they can also take out this message. We have engaged with politicians, our members of parliament, the cultural leaders. So we are actually trying to make sure that we spread this good gospel about self-care. So this is not the first, this is not the last session. We are going to have more sessions about self-care, and we really want to thank the viewers who have put off time to listen to us and also watch this session. Thank you so much.
Thank you so much, Dr. Christine. Fatia, in a minute, summarize your last message to our viewer.
I think my message is that we are here with Ministry of Health talking about self-care. But I want to say my final message is that all other sectors of government, we, the civil society organizations, private sector, we all need to be talking about health. We all need to be contributing to our health society. And on that note, I want to mention that in September, the first week of September, the Ministry of Health, together with us, SEHAD, and other partners, are organizing the first conference that is focusing on the right to health, where we are bridging gaps between the health system and all those other sectors: agriculture, education, gender, trade, all of them, because all other sectors need to also be here promoting health, speaking about health, including health in their own programming and including health in their own policies and budgets. So I want to say this conference will be very important, and it's a message out there that let's look out for this conference, which will happen in the first week of September, for all of us to work together and ensure that we realize universal health coverage and equitable health for all the people, where they are, irrespective of their social status.
Okay. Thank you so much, Fatia. Thanks so much, Dr. Christine, and thank you so much, Dr. Rosalind. And of course, to your viewer, we appreciate the time you have given in. Every Austin Mkalas is my name, about with Jonan and Muhumuza. From the entire team, we wish you a blessed night. Next is Soul Moment.
Family Hour, empowering families one episode at a time. Together, we build strong, healthy, and thriving families with our daily dose of inspiration and expert insights on topics that matter, like education and career growth.
God did not give the white people or the black people less talents. No. By the time God said, go and take control, that means God, our Father, the Creator, had put all the abilities in us.
Family health.
No one should one day tell you that, hey, since you have diabetes, you should not take Caro. That's a lie. There's what you call portion control.
Finance and wealth.
Keep track of your spending.